goose or something flying over, migrating south or something. So it's 95 and 30 seconds. Roy Exon keeps going. He lives, Father. Well, good afternoon. I'm Hamilton County Mayor Jim Coppinger, and if you're joining us on Facebook Live, we certainly appreciate that. This is our first attempt. We hope that we get better as time goes on, but most importantly, our goal is to inform the public in a really unfiltered way what it is that's going on in our health department, what we're doing with testing, what we're doing with vaccines, and how to make sure that the citizens are getting the best information and the most current information. So we don't expect it to be perfect, but we will make adjustments as we go through. We have asked citizens over the past several days to send in any questions they want, and we'll make sure that people understand. We'll still do media conferences. That will be for the media. What we're trying to accomplish here with Facebook is for it to be for the general public and to answer questions they may have. So if you got any, feel free to send them in, and we'll try to get to them. Becky Barnes is with us today to answer the questions that you might have. Things are actually going well. I think we're hearing a lot of positive comments since we've gone to appointment-only vaccines. This is something, as we rolled out in the beginning, we had some hiccups. We're pleased with where we are now. We have a call center to take people that call in that don't have access to the computer. And then we have people, obviously, that can log on to the computer and schedule their own appointments. And this is really important to all of us and to our community as well. So what I want to say is the most important thing about appointments only is don't come until 15 minutes prior to your appointment. please cooperate with us. We don't want to be backing up traffic, creating hazards to the people that are in line waiting, or people that are trying to get there, or people that just happen to be in the wrong place at the wrong time. So again, remember, 15 minutes before your appointment is plenty of time. So if you've got a 2 o'clock appointment, don't come at 9 o'clock. Come at 1:45 and you'll get through just fine. So that's really important to us. I just want to recap some of where we've been from the beginning. As you remember, this started back in March, middle of March 13th, here in Hamilton County. And if you'll recall, at that particular time, we had issues with testing. We weren't equipped to do that. That's really not something the health department had been responsible for. I'm not sure that it's still their responsibility, but once again, when they were asked to take on this, we've come from where we were testing only a couple of hundred a day to where we average about 1,000 a day at the Austin site. So we've come a long way. We partnered with many people in the community that have helped us, for anyone from Clinica Medicos. Really want to give a shout out to Dr. Kelly Arnold and Dr. Metters, and want to give a shout out to SIMPA with Shannon Stevenson. Again, these are some of the partners. We partnered with the African American community, with the churches, to do testing. So as you can see, as time went on, we got much better at testing, and so where we are today, we feel like we really are comfortable. Now, that's where we need to get with the vaccines, and we will eventually. The problem we have today, and the problem we're going to have probably for quite some time, is we don't have enough vaccines to do the vaccinations. We have a limited supply, and as that supply comes online, our goal is the health department gets it out as quickly as possible, and they will continue to do that. But now we're doing it by appointment only. And again, as I said, you know, we hope to get as good at vaccinations, and I have no reason to believe that we won't. I think the ones of you in the community have seen what we were able to accomplish with testing, and we're certainly looking forward to being able to repeat that in vaccinations. We will have partners eventually. It won't all be coming just to health departments or hospitals. We look forward to the future to where, you know, you'll have clinics that have it, you'll have pharmacies, different locations, but we're not there yet, folks. So please, you know, cooperate with us. Only show up a short time before your appointment, and let's continue to work together. And I know we will. What else have we done during this period of time since March? In the beginning, you may recall, there was a lot of emphasis put on contact tracing. We still do contact tracing. It's a bigger challenge the more people you have. We have seen a great decline in our numbers over the last week, so we're holding our breath and crossing our fingers. Our hospitalizations are down, our ICU people are down, the number of Hamilton County residents in the hospital are down considerably, and our positivity rate on testing is down. So again, we think we're trending in the right direction now, so that would not be possible without you, the citizens, cooperating with us when we say that you need to wear masks, socially distance, and please avoid small and large gatherings. It makes a tremendous amount of difference. So we did testing, we did contact tracing, and now we're looking at the vaccine portion of which is going to drive us across the finish line, ladies and gentlemen, and we're really excited about that. But we got to be patient. That's not going to happen in the next couple of months. It's going to take a long time to get 80 to 85% is certainly our goal. We can only do that with your help. We want 80 to 85% of the people in this county vaccinated. So we can only do that with your assistance. So please encourage your friends, your neighbors, your family, you know, when it's available to you, to come out and be vaccinated. We've also, you the taxpayers, have helped us in hiring over 100 new employees for our health department. This has been extremely labor intense, continues to be. And ladies and gentlemen, just frankly, our health department is worked to the bone, literally. And we continue to ask for more and more from them, and they always deliver. So really are excited. It's a great group of people to work with. I couldn't be any more proud of what they've done. And again, I ask of you, I know the ones of you that have taken the time to tune in are people that are supportive of what we're trying to accomplish, and we welcome constructive criticism. But the hatred that comes on Facebooks or call centers or to our hotlines, ladies and gentlemen, there's no place for that. We're trying to get through this pandemic together, okay? And the people that answer these phones or take these calls, or read these nasty emails, it's not them that I think you really want to vent your frustrations towards. I think Becky Barnes would agree with me. There's times we've been frustrated too. It doesn't move as quickly as we want to. But again, with a limited number of vaccines, we're doing the best we can. I really want to say I appreciate the cooperation we're getting from the public with the mask mandate. Again, we know this makes a difference. It's not 100%, ladies and gentlemen. We never said that it was. But what we do know is it does help minimize the spread. And if I'm wearing a mask and you're wearing a mask, then that even doubles our chances of minimizing the spread. And then on top of that, if you will socially distance, then we got a really good chance of slowing down this spread of this vaccine. And the numbers are reflecting that right now. I think all of us learned a lot over the Thanksgiving holidays when our numbers were going through the roof, literally. Our hospitalizations were out of control. We called on the public and asked the public to help us, and you've done that. So thank you. Appreciate it. The one question I'm going to answer before Ms. Barnes comes up and answers some of the questions, and the way we're going to do this, and we'll do this every week, what she's doing today is the majority of the questions we got that were similar questions. That's what we feel the public wants to hear about and what the public wants to know. And as we go forward, we'll be doing these on a weekly basis. We're not sure on what days we're going to do them yet. We're going to see how this goes, and we'll go back and regroup. And again, with the intent is nothing other than to inform the public and to do it in an unfiltered, uncensored way to where we can make sure you're getting the best information and that you're not getting it from your internet or your Facebooks or people that really do not understand what's going on as far as the details of the health department and the approach that we're taking. As I said, lastly, the question I'm going to answer is one that is a question actually for me, and Ms. Barnes will take the rest of the questions, but the question was posed was, what are we doing about Enterprise South Nature Park? Are we going to stand that side up for testing? And the answer to you would be, I certainly hope so. But here's what it would take. It would take a whole lot of vaccine. So we've got two sites right now that we're doing by appointment only, working out really well, and we'll continue to do appointments. The Enterprise South is and always has been a contingency plan because we had to get people off of Amnicola Highway, and we've done that, but we learned real quickly that you can't stack cars on that side even using the Chattanooga State campus. So the short answer is yes, it's still under consideration, and we're standing at we're standing up the infrastructure right now. Probably be ready to go in the event that we need it. I'm not saying that we're going to need it. I'm saying in the event that we need it, we will be prepared to do so. And that's really important to know because that particular site, what we do know is that you can stack actually 1,600 cars there and not even be on the roadway. And so, again, it's just giving consideration. Please don't run out and tell your friends and neighbors they're going to open Enterprise South Nature Park anytime soon for vaccination. If you hear of us opening Enterprise South Nature Park, you'll know that we received a large shipment of vaccine and we need another site or several more sites to be able to do this. I know Ms. Barnes is going to address the issues about equity and how we're trying to do this in the community. And I'll just kind of broad brush this and say, it's a concern of ours. It always is and always will be. Is as we roll out the vaccine, how do we get to our minority communities? How do we get to our African American population? We were able to do that through testing, extremely effective through working through churches. We certainly plan on doing some of that. We also, with the help, as I mentioned, Clinica Medicos with testing, people like that will be calling on again to help us with the Hispanic or Latinx community. And we just look forward to the partnerships that we're going to have. And remember this, citizens here in Hamilton County, we're all in this together. There may be some of us that are having to make more decisions than others, but we're all in it together. And I haven't been in touch with one single person that's been working on this, either from inside county government or outside, that doesn't have the same will to try to minimize the spread of this in our community. So help us, be positive about it. I certainly am. We see light at the end of the tunnel with this vaccine, and certainly we see light at the end of the tunnel with what some of our numbers have done. So please help keep us going in a positive direction. With that, I have the honor and the privilege to introduce someone that I work with every day. And when I say every day, I mean 7 days a week. We talk probably several times a day, every day on the phone, if not in person. Someone that's been totally committed to this from day one, that heads up our county health department and has for decades, ladies and gentlemen, for decades. I don't know of anybody that's got any more experience in public health in this county than Becky Barnes. So, again, we need to get behind what the health department's doing, get behind what we're trying to do here, stay upbeat, stay positive about it. One of the things we said to you about mask mandate that was so important, and I still get emails and it kind of puzzles me that people, we've opened everything back up. There may be some social distancing requirements or mask requirements, but we've opened the economy back up. We're not shut down like they are in other parts of the country. And this is something that, we're working on. We're working with our schools. We know the importance of a student being in front of a teacher. We know the importance of them being with their classmates. And again, we're working every day diligently to make that happen as quickly as possible. Now here's Becky Barnes, our Administrator of Public Health.
Thank you, Mayor Coppinger, and thank you all for joining us today. Sometimes when you're the second speaker, especially following Mayor Coppinger, he's really hit most all of the high points, so my comments will be fairly brief. We have totally reworked our vaccination system, as the Mayor said, to include appointments. This was necessary due to great demand and limited vaccine supplies. So last Friday, our EMA brought up this appointment system. So residents can now call the appointment center and schedule first or second dose appointments, or they can go online and schedule appointments themselves. So this new system started up last weekend and went very well, and by 2 p.m. on Sunday, all of the first dose appointments were filled, which was 2,912. So scheduling continues for second doses, so we still have openings for second doses, and persons can schedule those online or by phone, and we do have bilingual staff if you need that help. So as the Mayor said, this is really important to know. We have enough vaccine for all appointments, both first doses and second doses. So if we make an appointment, we have the vaccine in our freezer. So it's important, again, to follow the instructions, and as the Mayor said again, do not arrive more than 15 minutes early. So if you arrive on time, not too early or too late, that will help us have a low wait experience for you and help us have it to be safe with few traffic problems. When we have more vaccine, we will open up more appointments, and the best way to know when we have new appointments open up is to subscribe to our newsletter. A link to subscribe is available in the comments section, and you will get an email straight to you and let you know when appointments open up. If you're in 1A1 or 1A2 or age 75 or greater, please seek vaccinations as soon as you can get an appointment. Now I know they're tight appointments right now, but as time rolls on, we encourage you to keep seeking an appointment. We'll keep posting those appointments, and when those appointments become unfilled, that is our signal to move on and open up other groups for vaccination. So if you qualify, keep seeking vaccination appointment. If you schedule an appointment and you need assistance for transportation, we can help you with that. Call our hotline, 209-8383. Try to call several days ahead of time so we can get you scheduled when your appointment is. I want to talk just a little bit about positive cases, and there is good news, as the mayor said, with our positive cases. After our holiday surge, we are now seeing a drop in average cases. Today our cases are 205. The way we sustain that drop and hopefully continue to reduce our positive cases further is everyone has to stay vigilant to combat the COVID-19 virus. So limit close interactions to only household members. Wear a mask, social distance around people you don't live with. I know we've said this, and sometimes it gets to be too routine and maybe we don't do that, but these are the things that we have to do. As a result of our declining positive cases, we've seen a decrease in demand for testing at our Alston site. So effective this Sunday, we will be closed on Sunday.
Can you hold the microphone?
Oh. As a result of declining positive cases, we have seen less demand for testing at our Alston site. Effective this Sunday, Alston will be closed on Sundays, and this will allow us to reassign staff to vaccination efforts. We'll still be testing 6 days a week, and that will be from 10 to 2:30. If we need to shift back to being open on Sunday, we can do that. But we are very hopeful that this reduction in cases, that we can maintain that, and even further reduce cases, that it's going to take us all working together. So now I'm going to answer a couple of questions that we've gotten. And for sure, the number one question is, when will you have more first dose vaccination appointments available? Well, hopefully we will open up more appointments tomorrow. We're working really hard to make that happen, so you subscribe to the newsletter, and as soon as appointments are available, you will get that notice. And then the second question is, when will you open up the 65 to 75 age band? That will be when we feel like the 75 and above have had ample opportunity, and that we will gauge that when we have appointments that we're opening up in that age band and they go unfilled. So that's why we're saying seek appointments if you are in that 75 and above age band. And the other question was, are you still getting phase 1A1 frontline healthcare workers and first responders wanting the vaccine, or has that phase been completed? Well, we are still getting persons that qualify in that phase, and until 100% of people in that phase are vaccinated, we're still open. So we encourage anyone in any phase that we've moved beyond and opened more, it's always still continuing to be open to them. So thank you, and I'm going to turn it back over to the mayor.
Thank you, Becky, and thank you for the ones that joined in with us today. I do understand there were some audio issues. That'll be the number one thing we correct next time. Look forward to seeing you soon. And again, in any way you can help get out a positive message for us, it's going to make all of us better and healthier and safer. So thank you. Take care and God bless.